Hi, I'm Tom Jesson, and for Trust Me, I'm a Physiotherapist, I've recorded a lecture on sciatica. This trailer is going to tell you a little bit about what's in the lecture. In the first module, we're going to cover what are we talking about. What is sciatica? What's radicular pain, referred pain, radiculopathy? What do all these words mean? And you'll have that straight in your head when we finish module 1. The second module, we're going to zoom in a little bit and look at nerve root anatomy. We've got some great illustrations, we've got some great pictures of the actual clinical anatomy so that you know what we're talking about and you can picture it in your head. And then we'll talk about, well, how does all that stuff become painful? Why does it hurt? Then we'll go on to talk about what does the disc have to do with all this. We all talk about disc herniations every day, we see them on MRI, but why do they actually cause pain? And we'll go into that so that you know more about it. Then we'll focus on some key points when it comes to assessment. I'm not going to tell you how to do what you do every day. We're not going to go into how to do a neuro exam and all that stuff. We're going to pick up on some specific, key, important things that you can do to level up your assessment of people who have sciatica. And finally, we're going to talk about some key points about treatment. We're going to talk about the evidence around exercise, drugs, surgery, injections, all that stuff. And most importantly, we're going to talk about how to talk to people with sciatica, some things to mention, some things to pick up on, so that then when they leave the consultation, they're less anxious, they're happier, and they're more confident in their position. So that's what we're going to cover in the lecture. I hope you come and join us.